Welcome to the Encouragement for Work podcast with your host, Mark Griffin, founder and owner of In His Name HR. Each week, Mark interviews nationally known thought leaders from corporate America, higher education, churches, and ministries. His goal is to bring you great ideas that help engage your employees, shift your culture toward higher performance, and increase employee loyalty at the organization you lead. Each episode features an idea or process that's made a tremendous impact on employees and employers alike. Now sit back, relax, and listen in as he delivers encouragement today through this episode's special guest.
Hello, and welcome to the Encouragement for Work podcast. I'm your host, Mark Griffin. Today, I am really excited to introduce our guest, Julie Garrett.
Hi.
Julie comes to us with an incredible amount of experience in the benefit space. I've known Julie, my goodness, for
a
over
long
20
time.
years now. A long time.
Oh
That's
my
right.
gosh. How has it been that long, Mark?
Yes. It has been a long time. So I'd like to welcome Julie, and Julie's going to give you a little bit about her background before we get into our questions.
Yeah.
Julie, welcome to the Encouragement for Work podcast.
Thank you, Mark. Happy to be here. So I started my career, as you said, about, 20 years ago at this point. It's been a minute. But I got my degree in communications from Liberty University. So that's in beautiful Lynchburg, Virginia. Absolutely love it out there. And my plan was to go into some kind of broadcasting career. And that plan kind of got derailed. And somehow I kind of tripped and fell into the insurance industry. I don't know that anyone chooses this life. But
It's kind of like being in HR. Nobody wakes up and says, I want a career in human resources.
Exactly. So it wasn't something that was on my career path, but one thing led to another, and I ended up at Paychex. Actually, so this was back in 2009. This is when our paths crossed.
Sure.
They have an insurance agency at Paychex, and it was very new. I had just gotten licensed. I didn't even know what a deductible was, and they just kind of threw me out to the wolves to figure it all out. And so here I am, still going strong in 2026, which is crazy.
Thank you for the wonderful introduction, Julie.
Yeah.
Part of knowing Julie is some of the work that we've done. And before we get into some of the questions with Julie, we've literally saved over $1 million for one organization several years ago. But we work a lot with Julie, with our clients. And we're also focusing on smaller organizations this year, entrepreneur organizations. We're working with some companies with some hyper growth. So we're excited to have Julie on the show. Julie, what are some of the current trends you're seeing as it relates to like healthcare, but most importantly, from Encouragement for Work perspective, we look at the employee, how the employee's perceiving things. What's the trends you're seeing?
Sure. Well, unfortunately, the trends that we're seeing is, of course, costs are skyrocketing as usual. Healthcare is now growing faster than wages, which is just crazy. On top of that, healthcare represents 20% of the US GDP. So that's a problem as well, with no end in sight, right? So we know that there has to be some major changes because it's not sustainable. It's going to blow up at some point if something doesn't happen.
Sure.
So that's what's trending in the healthcare world. We hope that Congress might break up the vertical integration, maybe some wholesale reform. Trump did put the big, beautiful bill in place in 2025 to try to help in some certain areas. So we'll see how that kind of shakes out. But unfortunately, it's been a long time since it's been a positive experience in the health insurance world. It's increased costs, and it seems like the quality of care is decreasing. Like deductibles are going even higher. Doctors are more rushed. So the model is shifting toward a value-based care, which will reward providers for keeping people healthy rather than just the volume of services delivered. So that's the direction they're trying to go, and they're trying to make change. So that's, I guess, the positive thing.
Sure. As it relates to the employer, before we get into the employee, have you seen any plans or offerings where there was a decrease that you could say, hey, you need to look at this plan or this offering, or is wholesale across the board, everything's up 10, 20, 30%?
I mean, everything is increasing yearly just with trend. It goes up, and I'm not going to put the cart before the horse, but one of the reasons why you have me on today's show is to talk about the solution out there that was put in place by the administration in 2020. So that is definitely impacting employers in a positive way. It's not for every employer, but we'll get
Sure.
into that here in a bit. So
Okay,
yeah,
that's good.
there definitely are solutions out there, Mark, outside of the ICHRA that we're going to talk about that can definitely help reduce costs. And I work with all of those solutions. It's just a matter of which one fits
Wonderful.
for each
Thank
employer.
you.
Yeah.
So, as it
Mhm.
relates to the employee, what are some of the trends that you're seeing?
Sure. So, as far as the employee goes, I think that employers are doing a really good job and trying really hard to kind of with recruitment and retention because it's been a negative
Sure.
experience, I think, in the healthcare space for so long. They're increasing contributions or they're adding wellness programs or different incentives to help their employees seek quality care to keep them healthy, to keep them happy. There's a lot of initiatives being put in place by employers on mental health. That's one of the
Exactly.
biggest
Yes.
things that we're seeing out there. Companies are getting very creative. A few of our clients are starting to put their own in-house counseling services in place, which
Sure.
is very unique and can be very impactful.
And also very difficult to do that. We
It
used to have
is.
EAP many years ago, but then the
Mhm.
documentation that's required has made it cost prohibitive for employers. We're seeing many organizations navigate away from the psychologist venue to actually offering chaplain services
Mhm.
because the threshold is not as great on getting certifications and things like that.
Yeah,
That's wonderful that you're seeing that and that organizations are standing in the gap.
they are.
Before we move into the ICHRA, the final question was around educating employees on the employee benefit cost. And this is one thing that I'm very passionate about because oftentimes when employers do it, it's the
Mhm.
first time and employees have never really realized how expensive it was. So
Yeah.
what's some creative ways to get employees to understand and to buy in on what those benefit costs are?
Sure. I think the one that I see the most effective would be doing an employee compensation study, which I know, Mark, you offer those services as well. The reason being is, to your point, people don't know what they don't know. They think the grass is greener on the other side. They don't have a good benchmark as to how expensive healthcare is. I'll give you an example. This was from years ago, but it stuck with me because my mind was blown. I was meeting with an employee at one of the companies that I partnered with, and he was like just complaining about the cost of his healthcare. And this was probably back in 2013. So back then rates were way better.
Sure.
I think his single rate was like $400 or something, which was
Wow.
high at the time, but like
Hmm.
now we would be like, that's
Wow.
incredible.
Yes. Hmm.
But it was high at the time, but still it was reasonable. And I remember he was complaining though specifically because he had to pay, I think the employer paid a big portion of the single coverage and he was paying like $40 a month
Wow.
for his coverage. And whenever we shared with him the actual total premium,
Hmm.
the $400 a month he would have to be paying, he was just, you know, he
Flabbergasted.
got
Sure.
quiet real quick.
Sure.
Yeah.
Sure.
But my point is he didn't know. And so it's even harder in this day and age to find good people and to retain those good people. It's so challenging and it has been challenging for years. So it's really important that your employees know the quality of the benefits that are offered and also how much the employer is contributing because a lot of them have no idea
Exactly.
and people are losing employees left and right. So you could have the best benefits out there, but if it's not communicated correctly, they don't see the value.
So, listeners, what Julie's saying is maybe at the end of the year, you can send a letter to the employees' homes with an outline of, hey, here's the benefits that you've received, here's your pay that you've received. But, what many organizations do is align the cost to it. So, if they had 3 weeks of vacation, what was the cost to the employer? What was the cost to the employer for dental, vision, all those other expenses? It's really important to inform your employees, but also you can use employee climate surveys as well. We're seeing a resurgence with employers requesting that service. That was something that was really big in the 90s, but now it can be a tool that's used. So let's jump into the ICHRA. Julie, why don't you
Mhm.
define to our listeners what it is, why it
Sure.
was created, and why you're talking about it today?
Absolutely. So ICHRAs were launched in, like I mentioned, 2020, back in January of 2020, which is great timing, right?
It is.
So nothing else was
No.
happening that year.
Yep.
Totally smooth
Yep.
rollout, no
No distractions.
distractions whatsoever. Not at all. But it's a health benefit solution that can save employers 20 to 30% on healthcare costs, and it gives employees more choice. Yet, I would say over half of brokers aren't presenting it to their clients. Either they don't feel comfortable, they're not informed enough on it. And quite frankly, the commissions aren't as high on ICHRAs as they are traditional. So sometimes,
Sure.
they're like, wow, if it's not broke and making a little bit more money, they may not
Well,
present
and I'm
it.
sure it keeps the costs down.
For sure. And so ICHRA, if you're wondering what it stands for Individual Coverage Health Reimbursement Arrangement. So naturally, they had to give it an acronym because if you say that 3 times fast, your furniture starts floating.
Sure.
So, but what makes the ICHRA different, it's like just think of giving your employee a healthcare allowance instead of a group plan. So you as the employer, you set a monthly amount and the employees shop the individual market and they get reimbursed tax free. So it's just like giving somebody a gift card
Sure.
versus picking the actual present out for them. But it's great because it helps with predictable budgeting. So you as the employer set the contribution amount, period.
Exactly.
And that's it. The employees get portability.
They do.
So the plan
Hmm.
follows them if they change jobs, which is nice for them. This seems overwhelming, but it's actually a good thing. So there's 400 plus plan options in most markets versus offering your employees
2 or
2 to
3.
3,
Sure.
maybe 4
Exactly.
plans. And it's the fastest growing alternative to traditional group plans right now too. So it's hot right now. So, yeah.
It is. It's incredible. And listeners, for those that were doing HR like in the 90s, many organizations were doing something very, very similar. They
Mhm.
were allowing employees to choose how much vacation time, how much they had in benefit coverage. And part of that was having choice on the medical providers as well. Not as many as the ICHRA has, but
Mhm.
there would be 2, 3, 4 plans in the community. Quaker Oats was one of the premier organizations to be offering that to employees. So I'm really excited about this being relaunched as a benefit. So,
Yeah.
how does this offer more choices to employees without, the loss of control on the cost? I think that's what most employers are nervous about is, oh, if we
Mhm.
open this up, how is this going to affect our budget?
Sure. Well, and that's the beauty of the ICHRA. As the employer, you set a flat contribution amount and that's it. So you'll know what your budget is for the year. And the ICHRA works really great for nonprofits and faith-based organizations because typically they have tight budgets and they have unpredictable funding cycles. And usually mission-driven employees value flexibility over like the gold-plated benefits.
Exactly.
They usually have a younger, diverse workforce, which is full of like full-time, part-time volunteers, things like that. And you can class out the ICHRA, so you can actually offer the ICHRA 2 different classes. So if you had a 1099 employee, there is a way to include them in the benefits should you so choose to, but we just have to class them out appropriately. But you can do different contribution amounts as well for different classes of
Sure.
employees.
It's an incredible way to offer benefits to your employees. And again, listeners, this is really important. We were in a conversation a few weeks ago, Julie and I, and somebody asked, what's going to be the cost of the benefits? Well,
Mm-hmm.
at the end of the day, it's really up to the company to decide what the cost of the benefits are.
Mm-hmm.
If you want to contribute 2,000 per family or 4,000 or 6,000 per family, that's what you're going to contribute. So you're going to budget against that, and the employee and the employee's family are going to pick up the difference. So
Mm-hmm.
does that explanation kind of help, Julie, on
Yeah.
how the ICHRA works?
Absolutely. And it's not as overwhelming. I know when I said there's 400 plus plans, and
Sure.
sometimes too much choice can be a bad thing. So, for example, if you have an organization here in Pennsylvania, but you have remote employees, and let's say that one works in Minnesota and
Thank
one
you.
works in
Yes.
Ohio, the nice thing with that is that there, when I log in, so you would work through a TPA and they have their own online portal.
Yes.
So if I'm your employee, Mark, and I live in Ohio and I log into my portal, I see that I have, let's say, 75 plans that are available to me, and it's all using the networks that work for me in Ohio.
Exactly.
So it's great for people that have individuals outside of Pennsylvania. And then it's very easy for me to narrow down through filters, those 75 plans.
Sure.
I can say, well, I know that I want an HSA plan this year.
Yeah.
And so I can just pick HSA plans. If I just want to look at traditional PPO plans, I kind of know what deductible level I want. So it's easy to narrow it down.
Hmm.
And then on top of it, there's a whole support team that employees can call into as well to talk to someone to help, walk them through the benefits should they
Sure.
get stuck on something.
That's excellent. Thank you for sharing that. Julie, we're heading to wrap things up. We're
Mhm.
way over time. This has been a great opportunity for you to explain what the ICHRA is to people. I'm sure we'll have you back on in a couple months
That'd be
to
great.
give people an update, because I know this is getting more and more popular within organizations. And listeners, we'll have Julie's information and the link in our description. Julie, do you have anything else that you'd like to tell our listeners about the ICHRA and offer a closing?
Sure. So I would say the ICHRAs work best when you have three things. So if you have budget conscious employees who can navigate technology, and individual insurance markets with real competition, which we have a lot of them out here in Pennsylvania. I think that's where it works best. And I think that if your broker is not talking about it, definitely ask them about it. It's not a one size fits all, but it's
Sure.
been a great solution to a lot of our groups out here in Pennsylvania. And yeah, and Mark, thank you for graciously having me
No
on. It's
problem.
been such a
No, we're
pleasure.
so excited to get the word out about the ICHRA to all our partner organizations across the U.S. Julie, you've been a great guest. Thank you for being on our show. Listeners, have a great week. Bye-bye now.
Bye.
This episode of Encouragement for Work has been brought to you by Job Shepherd. Post-COVID-19 recruitment has been unquestionably hard for employers, with many struggling to find quality employees in the aftermath. Religious exempt employers have had an especially difficult time. Welcome to Job Shepherd, a platform that will change all of this for you. Job Shepherd was created to meet the demand by Christian employers, including ministries, camps, churches, colleges, and Christian for-profit companies in their search for qualified job candidates. Now, for a limited time only, employers post a job for free. Job seekers, come join us. You are always free. Learn more at www.jobshepherd.com.